Neuro-ophthalmology is an intersection of neurology and ophthalmology. Both neurologists and ophthalmologists will be interested in the clinical situations like defective visual fields, diplopia, or defective eye movements, because the underlying causes may be within the eye, orbit, or brain stem. So we'll focus on field of vision and its defects relating to neurological causes primarily here. So we'll go into anatomy of the visual pathway, then various visual field defects and underlying causes. Coming to the visual pathway, the visual signals pass through the lens, optic disc, optic nerve, optic chiasm, optic tract, and reaches the lateral geniculate body on both sides. And from that, the second order neuron carries the visual signals through optic radiation to reach the primary visual cortex, where the image, color image, and stereo vision are processed. So let's see various visual field defects consequent to damage to this visual pathway. Number one, anopia is complete loss of vision on one eye. This is due to the optic nerve compression or optic nerve lesion due to optic nerve glioma, orbital tumors, rarely pituitary tumor or thyroid eye disease. So you may have to look for other associated findings like hypopituitarism or hyperthyroidism. Coming to bitemporal hemianopia, which is the lesion of the optic chiasm, mainly it's due to the pituitary lesion, what you see here. And other causes could be craniopharyngioma, meningioma, or anterior communicating artery aneurysm. So coming to the homonymous hemianopia, there is loss or part or all of the left or right half of both the visual fields. You can see in the image there is a lesion of the temporal and occipital lobe. Usually the lesion anywhere posterior to the optic chiasm, involving the optic tract or lateral geniculate body, or sometimes involvement of the temporal, parietal, and occipital lobe. It's commonly due to stroke or tumors, less commonly due to aneurysm or trauma, and very rarely it can be a transient thing due to migraine. In superior quadrantanopia, you see the visual loss of quadrants on both sides. It is due to the lesion of the optic radiation. This image shows there is a lesion of the temporal and occipital lobe on the left side. The common causes could be stroke, intracranial tumors, aneurysms, demyelinating disease, temporal lobe surgery, arachnoid cyst. The associated clinical findings could be hemiplegia, hemianesthesia, or lobar dysfunction of temporal or occipital lobe, sometimes even parietal lobe dysfunction. Superior altitudinal hemianopia, and there is a altitudinal visual defects, and it does not cross the horizontal median. This is primarily ophthalmological lesions. See, this image shows the retinal detachment. The other causes could be neuropathy, hemibranch retinal artery occlusion, glaucoma, optic nerve or chiasmal lesions, optic nerve coloboma. Now coming to concentric peripheral field loss or binocular vision. See, the picture shows the common cause of retinitis pigmentosa. The other ophthalmological conditions could be glaucoma, chronic papilledema, pan-retinal photocoagulation for diabetic retinopathy, cancer-related retinopathy, autoimmune retinopathy, functional visual loss. Central scotoma, where you see the defect of round small defect in this central portion of the field. The image shows the optic neuritis, and the causes could be ischemic or Leber hereditary neuropathy, optic atrophy, tumor compressing optic nerve, and toxic metabolic disorders, sometimes occipital lobe lesions. So to conclude, neuro-ophthalmology is an intersection of clinical neurology and ophthalmology. It helps to diagnose various neurological and ophthalmological causes. Thus, visual field testing is an essential part of neurological examination. And we will see other neuro-ophthalmological topics like eye movements and disorders, as well as accommodation and pupillary abnormalities in the future videos. Thanks for watching.